Hello, everyone. I'm Kimberly Kane, President and CEO of Kane Communications Group. Many thanks to the Ascension All Saints Hospital Foundation for hosting this important discussion about women's cardiac health. Our panelists today are Dr. Desiree Dizagi, cardiologist at Ascension Medical Group. Dr. Dizagi is board certified in cardiovascular disease, nuclear cardiology, and internal medicine with a special interest in clinical cardiology, echocardiography, preventive cardiology, valvular heart disease, and women and heart disease. We also have Megan Justman. Megan is a regional supervisor of cardiac and pulmonary rehabilitation at Ascension All Saints Hospital and Ascension St. Francis Hospital. For the past 19 years, Megan has been a certified clinical exercise physiologist in the fields of cardiovascular and pulmonary rehabilitation. Megan takes great pride in her teams and the work they do to impact the health and wellness of the patients served by cardiac and pulmonary rehab. And let's welcome Claudia Van Clonensveld, Women of Worth Program Manager at Ascension All Saints Hospital and cardiac patient. Claudia survived a heart attack thanks to the care here at Ascension All Saints and has such important lessons to share with all of us. Thank you. Many thanks to all of you for being with us today. And I understand you all know each other as well.
We do.
All right. Well, we'll get into talking about that in just a few moments. But, I'd like to start with Claudia. Claudia, you may have gotten to know this group a little bit later because the doctor and Megan may have been working together already. So tell us how you got to know this group. What brought you into All Saints?
I really enjoy sharing my story because I'm hoping that it might help one woman out there and might save her life. And today I get to actually share my story. It all started right around the time that I was 50. I went to get my annual physical, and my doctor and I started to talk a little bit about going on medications for cholesterol because my cholesterol was a little high. And we actually had done a screening for cardiovascular disease because I do have a family history of cardiovascular disease. And it was just a very, very slight chance of cardiovascular disease. I was active, ate pretty healthy. So chances were real slim. So you know how they always do all of those really nice tests before we have to go have our physical done? Well, it just so happened that one of the tests that I had showed a little bit of blood in my urine. And so my doctor was very proactive. He wasn't really worried about it because women actually do have that happen to them once in a while. But he sent me for a CAT scan. So I went and had my CAT scan done, and thank goodness the radiologist that read the CAT scan actually found an abdominal aorta blockage. And so I called my doctor, and he sent me to the vein and vascular clinic because the abdominal aorta feeds the legs, and wanted to make sure that my legs weren't blocked. And so went and had scans done there, and the legs were a little blocked, but not too bad. So then he also sent me to a lipidologist, and she was going to help me get on some statins and for the cholesterol, even though it wasn't really high. But because of the blockage and all of that, just to make sure that I wasn't going to have a heart attack. And she recommended that I go have a stress test done. So I went into the hospital to have my stress test done. And when you first walk in for a stress test, the doctor looks at your resting heart. And my cardiologist at the time looked at the scan, and he was like, just what I want to see, a 20-year-old heart. And I was like, oh, good, woof. And so then I got on the treadmill, and it took me actually quite some time to get my heart rate up high enough for them to scan the stressed heart. So when I got it high enough and he took the scan of the stressed heart, I just remember the look on his face. His mouth dropped open. He's like, I don't believe this. You're like 75% blocked. And I'm like, what? So he and I talked, and we decided that I was going to have a cardiac catheterization done. And what that is where they go into your heart to see where there's any blockage. And if there's a blockage, they would put in a stent. And so I went in, I was really, really nervous, but they were all very kind there. And I guess he went up into the heart and saw that my main artery feeding the heart was actually 95% blocked.
Wow.
And that's the one that they call the widowmaker, because that's the one that if you do have a heart attack and it's that artery, pretty much you die. So he went out and talked to my mom and my family and would not let me leave the hospital. And I ended up having emergency triple bypass surgery the next day.
All of this testing, Claudia, did this all take place over the course of a day, or how long did all of this testing take from the moment you came in?
Months.
Mm-hmm.
Yeah, pretty much months.
So you stayed very connected to your doctors.
Absolutely, I did. Yep, absolutely, I did. So I was in the ICU for quite some time, probably about a week after I was sent to a regular room, and that's where I met Megan. And so Megan and her team from cardiac rehab, they actually started to come up to my room a couple times a day, just to start getting me walking again and get my strength back up. They were also very, very kind and gentle and encouraging. So I was in the hospital for about a week or so. And then when I got discharged the next day, I actually started cardiac rehab. And what was really nice about it is I already knew Megan and her team. So it was just very comforting walking in there, knowing people, not having to retell my whole story. You know, they all knew me. They knew my problems. They knew what I needed. So that also made it very, very easy to step into cardiac rehab. The other thing that was really nice is, you know, you just had your heart taken out of your body. So, you know, it's kind of really, really scary. And when you're in cardiac rehab, you've got all of these machines that are actually monitoring your heart while you're exercising. So there's that level of trust, kind of that level of knowing that somebody's watching, and if anything bad should happen, they would know before I probably would. So that was really nice about the cardiac rehab. The other thing that was really nice about cardiac rehab was there's so many other people there that had the exact same thing happen to them, that you had them to talk to, because there's all kinds of really odd things that happen to you, like you can't sleep, or you're really depressed, or you can hear your heart. It's so loud, you know, so some of those things are just like so different. And so having that support there as well was just really, really nice.
Any major lessons, Claudia, that you want to share with all of us based on this experience?
Well, the one thing that I was going to say is, you know, I'm really fortunate that I had blood in my urine. You know, I didn't have any of your typical symptoms. All my symptoms I attributed to the major stress that I had in my life. My neck hurt, but I was hunched over a computer. I was always really, really tired, but I was working 2 jobs. So it's, you know, I didn't listen to my symptoms. And if I didn't have that blood in my urine and my doctor wouldn't have been as proactive as he was, you know, 2 days after I had my heart surgery, we had our first snowfall. I would have been out shoveling. So it's really about listening to your body, you know, making sure that you do have a doctor and you talk to your doctor about your family history, and just really taking good care of yourself. I mean, I'm very, very grateful. You know, Dr. Desagi is now my cardiologist because my other cardiologist retired. But, you know, I've got this great team that's working with me. And, you know, I'm just very grateful that I'm able to tell my story and that I'm here.
And how are you doing today?
Great. I'm doing great. I mean, you know, there's been through all of this, I've had an abdominal aorta stent put in. I've had my carotid artery cleaned out of the plaque. And all of it is because I'm working with this amazing team and I'm following their recommendations. And, Megan and her group taught me how to exercise well. And, yeah, it's just been a hard journey, but I'm still here to tell it.
And I understand you have had an anniversary related to your event. Is that correct?
Actually, so today, the day that we're taping, yesterday was actually my 7-year anniversary.
Wow.
My heart anniversary.
Wow. Well, kudos to you. Thank goodness you're with us. To your point, thank goodness you were in and your physician caught things so easily, so early. You stayed connected with those physicians, and I think we're all thrilled that you're doing so well today. Claudia, thanks for sharing your story. I'd like to bring Dr. Dizaji in now. Doctor, is Claudia's case unusual based on your experience?
I think Claudia's case is unusual and fortunate. Like she said, that she was brought to the attention of her care team by the incidental blood in her urine that kind of led to testing. As she mentioned, it may have had a very different outcome had that not occurred, and she may have been shoveling snow with this 95% critical blockage. But the story itself, in terms of a woman with Claudia's risk factor profile with significant disease, no, it's not that uncommon. But I think there's a perception among a lot of us that it is something that we don't see in women, or we don't see in younger women. So we often aren't looking for it. Women aren't looking for it, and perhaps members of their care team might not be looking for it either, due to the perception that this is something that happens primarily to men or older women.
Based on your experience and based on the research, why is it that more women actually die from heart disease than men?
A few reasons. I think, as Claudia kind of mentioned, she had some symptoms leading up to this, but it's easy to attribute those to things going on at the moment, whether it's job, life, stress, menopause. Around the time women will start to have more of their cardiac symptoms might be at the time of menopause. And the vague symptoms that women can often manifest might simply be attributed to that time of their life. So one reason is women not coming to attention because they're not recognizing their symptoms or blaming their symptoms on something else. Symptoms in women can be more vague compared to maybe the traditional chest pressure or chest pain that men experience. So sometimes the symptoms are a little more vague and less dramatic. It might be something like fatigue, mild shortness of breath, sometimes not chest pain, but jaw pain, tooth pain, shoulder pain, arm pain, nausea. I've had a couple instances where women actually thought it was their gallbladder or an ulcer and went to see a gastroenterologist. And it wasn't until they got involved in that aspect of the testing that an EKG done actually showed that it was their heart. So I think there can be difficulty in making the diagnosis soon enough. And then I think in the treatment aspect of things, women can often have maybe less favorable outcomes, potentially owing to their size. Women tend to be smaller. Our blood vessels are smaller, so sometimes there can be higher risks of complications from some of the procedures that we have to be mindful of and take that into consideration. And then in terms of follow-up after the procedures, women may get less medications or participate less in some of their treatment plans, again, whether it's because they weren't potentially referred for those things or because they're not following up with those things because they don't have time. I've seen situations where women will make sure their children, parents, significant others come in for treatment, but yet don't seek the treatment for themselves.
Right. I was just going to ask you about that. Before this panel discussion, everyone has had the chance to see this video. It's just a little heart attack where, you see the actress in the video kind of go through the phases of a heart attack early on in the heart attack. And she seems very much in denial. She is taking care of everyone else around her before she's taking care of herself. And it sounds like one of the things you're saying, doctor, is it's very important for women to prioritize their own health and their own care.
Well, most definitely. I think there's a big sense of women as the caregivers, and making sure that everyone else is okay. What I try to impress upon people is that if you're not okay, you won't be in a position to make sure everyone else is okay. So it's important to remember to take care of your own medical appointments, your own screenings, follow up, all of these things. But it is a difficult situation in that sometimes the problem can be a little bit harder to diagnose in women because of the less typical presentation, and then women perhaps not taking it as seriously because they're focusing on the caregiving of everyone else.
Mm-hmm. Let's talk about treatment for women, heart disease treatment. Has the way women are, the way that women are treated for heart disease, has this changed over the years?
I think women are definitely being treated more aggressively, in the sense that they're definitely being offered the same level of care that men are being offered, whether it be the balloon procedure, angioplasty, or something like open heart surgery that Claudia went through. Traditionally, women weren't necessarily included in all of the trials and the studies looking at how best to treat heart disease. And there's definitely been a push, I'd say, over the past 20, 25 years to try to make sure women are included in these trials, so that we know that the medications we're using or the treatments we're using will show the same benefit in women. That's been problematic for two reasons. Number one is to try to get the women, to get the inclusion of women in the studies, but also to get the women that are asked to be included to participate. And back to those issues of the lifestyle, whether it be getting into that initial appointment, or perhaps participating in a trial to study a new drug or study a new procedure, women are less likely to take that opportunity and participate in something like that.
Is that something that might be recommended to them by a physician, or how would women find out about some of these?
It would be oftentimes at the physician level. Those discussions will take place, particularly if they're at a place that's actively involved in such a thing. Also, there's some work being done looking at, in the design of those studies and the design of those trials, what could they do to make it more appealing to women? Maybe it has to do with the hours that they're asking people to come in, or the type of communication they're doing. So not just in enlisting women, but how best to get women to participate.
Okay. Important for all of us to know. Let's go ahead and bring Megan into the conversation now. And Megan, Claudia talked quite a bit about her experience with you in rehab. What are the success rates for cardiac rehab?
The success rates are stunning. We see about a 26% reduction in mortality or dying at about 1 year for those who participate in cardiac rehab versus those who don't. And then also about an 18% reduction in readmission, so having to go back into the hospital. We see those benefits of participating in rehab last a good 5 years after the event itself.
Talk about what you do in cardiac rehab that makes it so successful.
When a patient comes to cardiac rehab, we really take some time to go through their risk factors for heart disease and the things that contributed to their blockages to begin with. And then we create an individualized plan that would address each one of those risk factors, both through an exercise program and through the education and the additional resources and support that go along with that. So a patient will come in by us for about 12 weeks, give or take, typically 3 times a week, but that does vary from time to time. And so they spend a significant amount of time with us where we can really help them to make those changes and then stick with them.
And based on the way that Claudia described it, it sounds like you also have a little bit of fun. It sounds like you really get to know the patients, when they come into cardiac rehab.
Yeah, That's absolutely, I think, one of the best parts about cardiac rehab is those relationships that are formed. And I know I personally will never, ever forget Claudia and the time that we spent together walking the halls.
Yeah. Well, and specifically, maybe you can go into some greater detail about what the cardiac rehab experience is. When I think about rehab, I think about exercise, but it sounds like it's pretty comprehensive.
Yeah, every program operates a little bit differently, but at Ascension All Saints, we are glad to offer group education classes each time a patient comes in. And so we actually have a series of about 27 education classes that patients may choose to take if they apply to that patient. 9 of which are led by a dietitian, and so focusing very heavily on making some healthy diet changes. We also offer some extra resources. So if a patient needs a consult to behavioral health, we have a behavioral health counselor right in our department, and we're able to get the patient in with her within a very short time frame to help them address anything that would maybe be beyond what we could offer for support in cardiac rehab. And then, yeah, we do exercise every session. That's probably the bulk of it. Most of our patients are wearing a heart monitor, so we can see their heart rate and heart rhythm and assess real time if they're tolerating the exercise. And we usually have a goal in mind. So it can be general fitness, or it can be to get them back to a specific activity. So if you have a patient who was maybe a triathlete beforehand, we would want to get them back to that, right? Or if we have a patient who has a very physically demanding job, we'd want to make sure that they're safe to go back to that job.
And Megan, what changes have you seen over the years in cardiac rehab?
Well, it's interesting that you mentioned that. So we're actually celebrating our 40th anniversary in our cardiac rehab program.
Congratulations, by the way.
Thank you. It was really built by the foresight of Dr. Howard Short, and we started in 1981 with one patient and one monitor, and I have some pictures to show you. So here you'll see a photo from the Racine Journal-Times highlighting our first cardiac rehab patient back in 1981 with our first nurse, Lori Peterson, and our first exercise physiologist, Barb. You can see back then our telemetry system was not very fancy. So the capabilities to see the EKG have improved greatly over the years. So this is looking at the heart's rate and rhythm. But one thing that hasn't changed is our focus on education and caring for the patient. And when I think back over my time at All Saints, I really think the best part is the team that I've worked with and the patients that we've cared for together. And I can honestly say, as I think back, over all the years that I've been at All Saints with everybody that I've worked with, every single person in our department has had that true passion for helping our patients get better. We did open a new facility. We moved into this facility a little bit more recently. And so our current facility, you'll be able to see the red floor around the edge here is actually a walking track. And so you can see that it'll go on the perimeter of the department. We have strength training equipment, and then we have cardiovascular equipment as well. And we've expanded our program from one patient at a time for the ability to care for up to 20 patients at one time. I do have a little bit of a video to show you so that you can get a little bit more of a feel for the facility. So you'll see different types of equipment here. These in the front are called a new step. They are a stair stepper machine, but recumbent, meaning the patient will sit down on them. We're able to adjust the equipment to a very low level so that somebody who's just starting with exercise really can start from the very, very basic part of the program. And then in the background, you can see a upright elliptical. And so we're really able to serve a wide variety of patients with the equipment that we have.
Megan, that's impressive. Very up-to-date equipment, just a beautiful, beautiful arena. I can see why patients like Claudia might be so dedicated to coming in for rehab.
Yeah.
That's a great place. I wonder if you could talk a little bit about the new tele-rehab equipment and how that will help enhance cardiac rehab.
Yeah, so we're looking to expand our telemetry equipment. Currently, we have a traditional monitoring desk. And so the computers are housed behind that desk. And our patients are out in the facility exercising on the equipment that you saw. And so while we do have a tablet where we can input data, we really aren't able to see as much of that telemetry equipment as we would like to be able to see and still be right next to the patient at the same time. And so this new equipment will put us out on the floor. The computers will be right out there and give us quicker access if a patient does have symptoms for us to be able to look at their rate, look at their rhythm, and see what's going on without having to run across the gym to get back to that computer. And it really allows us to spend more time with our patients, which I think Claudia did a great job explaining why that was so important.
Yeah, that's wonderful. Well, it sounds like you have created a very motivating and healthy environment, Megan, there with cardiac rehab. And, Dr. Dejaji, thank you so much for telling us about really the symptoms that we need to watch out for as women when it comes to heart disease and how important it is for us to pay attention to our health and stay on top of that. And Claudia, congratulations on your rehab. And, thank you for sharing your story with us. It's absolutely inspired us all. So thank you, everybody, for being here for this panel discussion and, best to continued successes.